Hello everyone, a very good evening to all of you. I hope I'm clearly visible, audible to you guys. So welcome you all for today's session. In this session, I'm going to start microbiology. So in microbiology, we will be studying microbiology according to the new curriculum. Let me start the microbiology from general microbiology. So in general microbiology, today I'm going to cover a very important topic, a very important portion from microbiology, from which every year many questions are asked. That is stains in microbiology. So there are many type of stains in microbiology. We will be studying all of them one by one. But today I am going to teach you gram staining in detail in this session. Everything about gram staining and other stains also, some other stains. So before starting my session, I would like to ask you 3 questions. You have to answer these questions in the chat box, right? So you have to answer these 3 questions. Let me see whether you can answer it right now or after my session. So I will ask the same 3 questions before the session and the same 3 questions after the session. So you can answer these questions clearly after attending my 20-minute session. Okay, so this is the first question. Can you tell me the correct order of gram staining? What is the correct order? You can see the 4 options in front of you. Is it gentian volate followed by iodine followed by carbonyl fission? Is it iodine followed by gentian volate followed by carbonyl fission? Is it carbonyl fission followed by iodine followed by gentian volate? Or is it the fourth option you can see in front of you? From ABCD, whatever you think is the correct answer, please write down in the chat box. This is question number 1. Can you answer it? Can you answer it? This is question number 2. Can you tell me the answer? Gentian volate coloration of the grams positive bacteria is due to what? Gentian volate color in gram positive bacteria is due to peptidoglycan content, due to capsule, due to cell membrane, or none of the above. What do you think? What do you think? And the third question is in front of you. Which of the following is a gram positive bacilli? GPB, gram positive bacilli. Is it Streptococcus, Salmonella, Mycobacterium tuberculosis, or Corynebacterium diphtheria? What it is it? So is it question? It is question number 3. You answer it in the comment box. What is the answer of question number 1, question number 2, and question number 3? The same 3 questions I will launch again after the session, and you will be sure and confident about the 3 answers, right? So let me start the session. So before starting the session, let me tell you something about the bacteria. What is the size of a bacteria? What is the size of the bacteria? The size of the bacteria is measured in micrometer. Micrometer, you know, micrometer, and 1 micrometer is equal to 10 to the power minus 6 meter. So we cannot see it with naked eyes. We cannot see it with naked eyes, because with naked eyes we can see smallest object 200 microns, 200 micrometer, the resolution power of unaided eye, the naked eye. So that's why we require an instrument, that is microscope. Without microscopes, the bacteria are not visible, because the size is in micrometer. The length is 2 to 5 micrometer and the width is 0.2 to 1.5 micrometer. So that is now. For the study of bacteria, 2 types of studies are possible. One is unstained preparation, one is stained preparation. Now many students ask me a question, ma'am, why staining is required? You will teach us many types of stain, the gram stain, the Giemsa stain, acid fast stain, simple stain, this stain, that stain. But why at all staining is required? Can't we observe the bacteria directly, that is unstained? Can't we? Can we? Yes or no? And if the answer is no, my question is why? Why the bacteria are not visible directly without staining? Is it always necessary to stain the bacteria if you want to study the bacteria? Is it? Is it? Now what is the answer? The answer is that all the bacteria are transparent. It is a rule. All the bacteria are transparent. All the bacteria are transparent. And the slide, you know, you take the bacteria on slide. This slide is also transparent. No, you cannot see transparent thing on a transparent background. If you want to see anything, with your eyes, you need contrast. You need contrast. Do you understand the meaning of contrast? Contrast ka meaning kya hota hai? What is the meaning of the contrast? What is the meaning of the contrast? The meaning of the contrast, either the background is transparent and the object on it is colorful, or vice versa. The background is colorful, the object is transparent. So if one of the thing is transparent, any of them is transparent, the other thing should be colorful to provide the contrast. Then only the thing will be visible to you. You got my point? To provide contrast must be there. If both of them are transparent, you cannot see that. You cannot see a transparent object on a transparent background. Currently the bacteria are transparent and the background slide is also transparent. So you cannot see it directly, right? That's why staining is required to provide contrast. The answer is contrast. We want to provide contrast. Okay? So that is the thing. Now, let me talk about the unstained preparation, the wet preparation and stained. Then you will ask me the next question, ma'am, if you are saying staining is always required, why you are teaching us unstained preparation and why unstained preparation are known as wet preparation? Now, my answer to this question, unstained preparations, I'm talking about the unstained one. Unstained preparations are not for looking the morphology of bacteria. They are for looking the motility of bacteria. इसमें बैक्टीरिया की मॉर्फोलॉजी नहीं दिखेगी आपको कि बैक्टीरिया कैसा है, what is the morphology of the bacteria, नहीं. Only mobile bacteria, when they will move from here to there, you can see something is moving. So unstained preparation is only to observe the motility of the bacteria. You got my point? So let me teach you the two type of preparation, unstained and stained, the two type of preparations. So unstained preparations are for motility of the bacteria, are for looking the motility of the bacteria. Now there is a preparation known as hanging drop preparation. What do you mean by hanging drop preparation? इस पे अलग से short note आता है, very short question और short question in university exam. What is hanging drop preparation और उसमें motility कैसे दिखती है बैक्टीरिया की? यहाँ पे we will not do staining. We will not do the staining. We will directly use the specimen. We will not stain it. Either gram stain, Giemsa stain, acid fast stain. No staining. So we will do hanging drop preparation कैसे होता है? So I will tell you the steps. Can you see? Take a cover slip. This is a cover slip. Can you see? This is a cover slip. At the four corners of the cover slip, apply Vaseline. Apply Vaseline with the help of the toothpick. This is toothpick. Take a toothpick and apply the four dots of the Vaseline at the four corners of a cover slip. At the center of the cover slip, place one drop. Place one drop of your specimen containing bacteria. So this is liquid drop. It contains bacteria. We are not staining it. Please mind my words. We are not staining it. We are using it directly. So at the center of the cover slip, put one drop of the specimen containing bacteria. Right? Now take a slide. Listen everyone, listen here. Take a slide with depression at the center. There is a depression at the center. Can you see? This is depression at the center. This one is depression at the center. You have to take a slide with depression at the center like this. Right? This is the slide with depression at the center. Now this is your cover slip. This is your cover slip. Your cover slip contains the drop. This is your drop containing bacteria, right? And at the four corners, Vaseline. Vaseline drop is already present to provide the elevation. Now you just take your cover slip and invert this cover slip over the slide. You got my point? What I am saying you, what I am asking you to do, I am asking you to take the slide and just invert the cover slip. This is the cover slip over it. Invert it. So it contains the bacteria at the center. The drop. So drop will hang. So this drop will hang like. So it is known as hanging drop preparation. Right. Now see directly under the microscope. You can see the bacteria which are motile here and there. They are moving from here and there. Have you got it? You are just inserting the cover slip over this slide having the depression at the center. You got my point? So these are the four Vaseline dots which are keeping it elevated. So can you see? This is the complete arrangement I am talking about. Everyone see, this is a slide with a depression. Everyone see. And this is the cover slip. Everyone see, this is the cover slip. At the center of the cover slip, this is the drop. So that is hanging. This is known as hanging drop preparation. Can you see? This one is hanging here. Everyone give me a thumbs up. Everyone. This is top view and this is transverse view. You got my point? Side view. Everyone gives. Now examine under microscope. If you are examining it under microscope, if you are examining it, you will see like this. You will see the transparent bacteria. These all are transparent bacteria. They are moving from here and there. So you cannot observe the morphology. You can observe the motility. So that is the unstained preparation, wet preparation, unstained preparation, hanging drop preparation. Hanging drop preparation. Why it is known as wet preparation? Because you can observe till the drop is wet. Once this drop becomes dry, you cannot observe the motility, the bacteria are dead. So only till it is wet, you can observe it. So either you say unstained, or you say wet, or you say hanging drop, one and the same thing. And these all things are for one thing. What is the utility? The utility is the motility, to observe the motility of the bacteria. That's it, nothing else. Everyone give me a thumbs up. Everyone. Coming on the stain preparation. Coming on the stain preparation. Now come on stain preparation. Why staining is required? I have already taught you. The staining is required because of lack of contrast. Because the bacteria is transparent. The slide is also transparent. That's why there is no contrast and you cannot see it. Without contrast, you cannot see it. That's why you require stains. There are 4 types of stains. Please learn the classification of stains. There are 4 types of stains. Please learn it. What are the 4 types of stains? Simple stain, negative stain, impregnation stain, and differential stain. Differential stains are of 3 types. Gram stain, acid fast stain, also known as Ziehl-Neelsen stain, and third is Albert stain. So I will be teaching you all one by one. Let me start with the first one, simple stain. Simple stain. Why simple is known as simple? Because it provides same color to all the bacteria. That's it. Same color to all bacteria. Learn 2 examples here. What are the 2 examples? Methylene blue. The first example is the methylene blue. Second example is basic fustian. So methylene blue and basic fustian are the 2 examples, right? That is the simple stain. You can see same color to all bacteria. Can you see? All bacteria having same color. So what are the 2 examples? Methylene blue and basic fustian. These 2 are simple stain. Everyone give me a thumbs up. The second is the negative stain. The negative stain. Why negative is known as negative? Why negative is known as negative? Because it do not stain bacteria. Then what does it stain? ये किसको stain करता है? It stain the background. Can you see the background become black? Can you see here the background? The background is stained. The bacteria are transparent. So the object to be seen is देखो ultimate purpose है contrast provide करना. Either you stain bacteria, the background is transparent, or you stain the background, the bacteria remain transparent. दोनों में से एक चीज को stain करो. Either the bacteria or the background. So in negative stain, you know photographs में भी negative होता है. Negative में the person is not colorful, the background is black. So it provides contrast, right? So here what we are doing, we are staining the background. The background is stained. While the structure to be seen is not stained. It will remain transparent only. So the unstained bacteria will stand out in the contrast, the background. So can you see this diagram? Here you can see the diagram. See the background. The background is stained and you can see the unstained bacteria which are standing out on a dark background. So this is the negative stain. This is negative stain. There are 2 examples of negative stain. What are the 2 examples of negative stain? Number 1, Indian ink. Number 2, Nigrosan. That's it. These are the 2 examples. Please learn. Indian ink and Nigrosan. Indian ink and Nigrosan. Right. Coming on the third method, third type of staining. The third type of staining is impregnation. Impregnation का मतलब होता है layering. Layer के ऊपर layer चढ़ाना. Layering. So some bacteria are very thin in nature. Can you see? The bacteria is very thin. बहुत thin है bacteria. So it is invisible. It is invisible. So what you are doing with the help of the stain, you are providing layers over the bacteria. You are layering. These are the layers of the stain. So layering is known as impregnation. Layering is done by silver. You know हिंदी में कहें तो चांदी. The chemical formula is Ag. You know chemistry में आपने पढ़ा होगा. So Ag की layering करते हैं. You know sweets मिठाइयों के ऊपर भी silver की coating होता है. In the same way, right? So sometimes the bacteria are very thin. They are too thin to be visible. So you are thickening the bacteria by layering of silver, and this is known as impregnation. So only one example is there, silver staining. Can you name some thin bacteria? कोई thin bacteria का नाम बताओ. The thinnest bacteria in the world is spirochetes. Spirochetes. You know the 3 type of spirochetes. So all the 3 type of spirochetes are very thin. That is Trypanosoma, Borrelia and Leptospira. These are the 3 examples, 3 types of spirochetes. These are very thin bacteria. So for spirochetes, we use impregnation. So you can see number 1. And number 2 for flagella, the bacteria flagella. You can see the flagella of the bacteria. Bacteria मत देखो, उसका flagella देखो. Flagella is also very thin. उसके लिए भी हम ये use करते हैं, right? So till now we have done 3. What are the 3? Can you tell me what is simple stain? Can you tell me what is negative stain? Can you tell me what is impregnation stain? Can you tell me? Simple is known as simple because it provides same color to all bacteria. Negative is known as negative because it stains the background, not the bacteria, right? And impregnation means layering. That's why it is used for thin, very thin bacteria. Now give me the examples. Who will give me the examples? Here two examples are there. Methylene blue, basic fission. Here two examples are there. Indian ink and nigrosin. Nigrosin. Here only one example is there. Silver. Silver. So that is the summary. You should know the definition, example. The definition, example. Definition, example. Definition, example. Now I am coming on the fourth type of stain, the most important, differential. Before that, I would like to ask you questions here. Okay. I would like to ask two questions here. Right. Based on these three states. Can you write your answers in the chat box? Can you please write your answers in the chat box? Please. So this is the first question in front of you. Can you answer it? One of the following staining method is an example of negative stain. Just now I taught you. What are the examples of negative stain? Can you tell me what are the examples of negative stain? Is it Gram stain, Fontana stain, Indian ink preparation or Ziehl-Neelsen stain? What is it? Can you answer it? A, B, C, D. You can write down your answer in the chat box. So I'm asking the answer for the negative stain. I'm asking the answer for the negative stain. Which of the following is a negative stain? Yes. So the correct answer here is the Indian ink preparation. Negative stains have two examples, Indian ink and nigrosin. Yes. So you all are right. The correct answer here is C. Right. Right. And this is the second question in front of you. Can you define negative stain? What is the definition of negative stain? Now it is a tricky question. Can you answer it? It is a tricky question. The first option is the structure to be demonstrated is stained. Is it? Or the structure to be demonstrated is not stained. Or the background is not stained. Or the background and the structure both are stained. What is negative stain? In the negative stain, if you say, ma'am, what is negative stain? The background is stained, right? The background is stained. And the structure to be demonstrated like bacteria, it is not stained. That is the definition. That is, now match the option. The structure to be demonstrated is stained? No. The structure to be demonstrated is not stained. Yes, it is right. The background is not stained. No, this is wrong. The background is stained. And the background structure both are stained? No, this is also wrong. So the correct answer here is B. It is a tricky question. You got my point? You got my point? So that is the tricky question. Now coming on differential stain. We have understood what are simple stain, what is negative stain, what is impregnation method for staining, and what are differential stains. We are starting now. Differential का मतलब है, differential stain is known as differential because it provides different color to different bacteria. It is in contrast with simple. Simple provides same color to all bacteria. It provides different color to different bacteria. So differential stains are of three types. Gram stain, acid fast stain, Albert stain. So I'm starting gram stain right now. In this session, I will be teaching you gram stain in detail. Right? So let me start the gram stain. Have you ever thought gram का नाम gram कहाँ से आया? Why gram is known as gram? Because gram stain was discovered by a scientist known as Christian Gram. Gram stain is discovered by a scientist known as Christian Gram. And it is the most widely used stain. Right? So that's why gram stain is known as gram stain. Now coming on the method, there are 4 steps in gram staining. Let me tell you what are the 4 steps. First, you do a primary stain. You do a primary stain. Then you apply mordant. I will tell you what is the meaning of the mordant. Right? First primary stain, then mordant. Right? Then you apply decolorizer. Okay? And then you apply secondary stain. These are the 4 steps. Listen here. I will tell you everything. The primary stain is always violet color. Any violet stain. Right? And secondary stain is always a red color. Always. It is a rule. Violet stain have many examples. Many examples like gentian violet. There are many examples. And red stain also have many examples like carbol fuchsin, saffronin. These all are examples of secondary stain or counter stain. Mordant is always iodine here. It is iodine. And decolorizer can be alcohol or can be acetone. Can be acetone. I will explain you everything. Learn the 4 steps first. Learn the 4 steps. So you can see the 4 steps. They are in front of you. As I have told you, the primary stain is a violet stain. So it is gentian violet. The second is the mordant, is iodine. Then decolorizer is alcohol. Alcohol or acetone both will work. And then secondary stain is the red stain. Any red stain. Carbol fuchsin. In the end, the bacteria which took the primary stain color, that is which are violet in color, they are gram positive. And the bacteria which took the secondary stain color, that is which look red in the end, they are known as gram negative. So what is the principle, how it is working, I will tell you everything. So listen, all bacteria are transparent. Bolo, all bacteria are transparent. Say yes or no. Either you say yes or you say no. All bacteria are transparent. You know this rule. So all the bacteria are transparent. You can see the bacteria are transparent, right? All the bacteria. Now you all are applying the primary stain. The primary stain is a violet stain. It can be gentian violet, crystal violet, any violet stain, any. That is primary stain. So all will take the primary stain and all will be violet. It is also violet. This one is also violet. Now you are applying iodine, which is acting as a mordant. Which is acting as a mordant. Mordant का मतलब क्या होता है? What is the meaning of the mordant? Listen, this is a transparent bacteria. Any transparent bacteria. You are applying the primary stain. So the primary stain is going inside. This is primary stain, violet stain, it is going inside. Now you are applying mordant. Mordant is iodine. Iodine is acting as a mordant. So iodine will also go inside and it will form a bond. It will form a complex with the primary stain. It will form a complex with the primary stain. So primary stain do not leak out. So mordant is something that is preventing the primary stain to leak out. That is the meaning of the mordant. तो यहाँ पे आयोडीन क्या करेगा? आयोडीन भी बैक्टीरिया के अंदर जाके प्राइमरी स्टेन के साथ बॉन्ड और कॉम्प्लेक्स बना लेगा ताकि प्राइमरी स्टेन लीक ना हो, वापस बाहर ना आए. ये हुआ मॉर्डेंट. उसके बाद सबसे मेन स्टेप है यू ऐड डीकलराइजर, आइदर अल्कोहल और एसीटोन. राइट. नाउ देयर आर सम बैक्टीरिया व्हिच आर रेजिस्टेंट टू डीकलराइजर. They are resistant. They are not decolorized. And there are some bacteria which are sensitive to decolorizer. So they are sensitive to decolorizer. So decolorizer will decolorize them. Now the one which are resistant to decolorizer, they are still violet. And the one which are sensitive for the decolorizer, they become transparent. They become transparent in step 3. Right. The last step is to add a counter stain, which is a secondary stain, which is any red stain, like safranin, carbol fuchsin. Now the one bacteria which was resistant, इसके अंदर जगह नहीं है. There is no space. It is already filled with the primary stain. It is still violet. In the end also it is still violet. There is no space inside it to take the secondary stain. But the one bacteria which is sensitive for decolorizer, it become empty. Now it become transparent. So it will pick up the secondary stain and in the end it will be red. So the one bacteria which is violet in the end are gram positive. And the one bacteria which are red in the end are gram negative. So can I say what are gram positive, what are gram negative? Can you enumerate? Can you enumerate the differences? Gram positive are the bacteria in the end they are violet. That is they took the primary stain color. Primary stain color. The bacteria which are red in the end, that is they took the secondary stain or counter stain color. They are gram negative. The gram positive bacteria are resistant to decolorizer. That's why they are violet only. They are retaining the primary stain. And the gram negative are sensitive to decolorizer. Sensitive to decolorizer. They are sensitive. So they lose the primary stain and they take the secondary stain. So this is the main difference. In the end, the violet one are gram positive. The red one are gram negative. Give me a thumbs up. Jitni audience utni thumbs up. Now my next question is why? Why this is happening? The difference in the third step. Why? Why some bacteria, they are resistant to decolorizer, that's why they are violet in the end, and why some of them are sensitive to decolorizer, that's why in the end they are red. I will answer this question first. See this diagram also. The 4 steps are crystal clear in front of you. Can you see step number 1? Can you see in step 1 you are adding violet stain, that is primary stain. So all bacteria are violet. All of them are violet. Can you see the color? They all are violet. In the second you are adding the iodine. This is iodine. So iodine is forming a complex, mordant. It is acting as a mordant. So still all bacteria are violet. यहाँ पे भी violet हैं, यहाँ पे भी all of them are violet. But in the third step, you are adding a decolorizer. You are adding a decolorizer with the help of dropper. Either alcohol, ethanol or acetone. So now some bacteria become transparent. See, ये सारे transparent है जो मैं red से mark कर रही हूँ. And some are not transparent. So some are violet. So some lose the primary stain, some do not lose the primary stain. So some are resistant, some are sensitive. The one which are resistant, they are violet. The one which are sensitive become transparent. And in the last step, you are adding secondary stain, which is a red stain, right? Like carbol, fuchsin or safranin. So the one which are violet, वो तो violet ही हैं. They are violet ही हैं. But the one which become transparent, they took the red color. You can see जो transparent थे वो red हो गए. So in the end, 2 type of bacteria. The one which are violet are gram positive, the one which are red is gram negative, right? So I guess everyone got it, right? So the 4 steps are crystal clear to you. Say yes or no. What is gentian violet? It is used as a primary stain. Not only gentian violet, it can be crystal violet also. Any violet, any violet. Iodine acts as a mordant. So iodine combines with the dye, form a complex and fixes the primary dye inside the cell so that it do not leak out. Leaking को prevent करता है. Then these are the decolorizing agents. It can be alcohol or acetone. And last is carbol fuchsin, which act as a secondary stain or counter stain, any red stain. It can be carbol fuchsin, it can be saffronin, anything will work. You got my point? In the end, the one which are violet are gram positive, the one which are red are gram negative. Now the question is why? You can see the two type of bacteria. The violet one are gram positive, and the red one, you can see the red one are gram negative. You can see, I guess the violet one are gram positive, the red one are gram negative. You can crystal clearly see the difference. Now, please classify the bacteria. This is the first classification. So in the world, some of the bacteria are gram positive, some are gram negative. That is, some are violet in color, some are red in color. Now based on the shape, bacteria are of two types. Based on shape, the one which are circular are known as cocci, and the one which are rod shaped are known as bacilli. The rod shaped are known as bacilli. You got my point? So circular shaped and rod shaped. Circular shaped are cocci and rod shaped are bacilli. Now combine the two classification. The first classification is gram positive, gram negative. Gram positive can be cocci, can be bacilli. Gram negative can be cocci, can be bacilli. So we are classifying. These are known as gram positive cocci. These are known as gram positive bacilli. These are known as gram negative cocci. These are known as gram negative bacilli. So GPC, GPB, GNC, GNB. These are the four types of bacteria in the world. So we are combining the two classification. The first classification is gram positive and gram negative. The second classification is cocci bacilli, cocci bacilli. Let's combine the two. So total 4 categories are there. Gram positive cocci, gram negative cocci. Gram positive bacilli, gram negative bacilli. You can understand the meaning. You can understand, I guess everyone can understand the meaning. So gram positive cocci, since they are cocci, so they are spherical. They are circular or spherical in shape, and they are gram positive, so they are spherical and violet, right? These are also spherical, but these are rod shape. These are also spherical, but these are red in color because they are gram negative. These are rod shaped. These are also rod shaped, but these are violet and these are red. So that is the meaning. That is the meaning. I guess everyone got it. Yes or no? Yes or no? Now divide all the bacteria into 4 categories. Can you do it for me? So gram positive cocci are only 2, Staphylococcus and Streptococcus. That's it. Enterococcus is not important, right? Gram, so only SS. Gram negative cocci are only 2, Neisseria and Moraxella. Neisseria and Moraxella, right? Now that is all about cocci. So cocci, gram positive cocci, gram negative cocci. Gram positive cocci, Staphylococcus, Streptococcus, negative cocci, Neisseria and Moraxella. You got my point? Now coming on rods. Gram positive bacilli are 5. A, B, C, D, L. The mnemonic is A, B, C, D, L. Actinomycetes, Bacillus, Anthrax, Clostridium, Diphtheria, Listeria. And gram negative rods are remaining all. Don't learn it. So please classify like this. Can you do the classification for me in the 4 categories? So first finish cocci, gram positive cocci, gram negative cocci. Then come on bacilli, gram positive bacilli, gram negative bacilli. Can you tell me the answers? Gram positive cocci are only 2, Staphylococcus, Streptococcus. Gram negative cocci again 2, Neisseria, Moraxella. Gram positive bacilli 5, A, B, C, D, L. Actinomycetes, Bacillus anthrax, Clostridium, Diphtheria, Listeria. And gram negative bacilli are remaining all. Remaining all. You can say all. जो भी बच गए, इनको छोड़ के, इन सबको छोड़ के जो भी बच गए. Now it can be Staphylococcus, it can be Salmonella, Shigella, E. coli, Klebsiella, it can be Mycoplasma, it can be Listeria, it can be Proteus, it can be Klebsiella, it can be anyone. So remaining all, don't learn the list. So इस यहाँ पे 2, यहाँ पे 2, यहाँ पे 5. So except these, everyone is gram negative bacilli. So this is the classification. Everyone give me a thumbs up. Everyone. Now why some bacteria are gram positive, some are gram negative? Can you tell me? The difference is in the cell wall, the structure of the cell wall. Now see, all bacteria have cell wall. Let me draw the 2 types of bacteria in front of you. This is also a bacteria. This is also a bacteria. Some bacteria have thick cell wall, having more peptidoglycan content in the cell wall. Some bacteria have thin cell wall, having less peptidoglycan content in the cell wall. You can see, right? Now, whenever you are giving the primary stain, it also take primary stain, become purple. It also take primary stain, become purple. You are giving the mordant. Now you are applying. Now you are applying the decolorizer. Here also. Since here the cell wall have more peptidoglycan content, the cell wall is thick. So decolorizer cannot decolorize the bacteria. The primary stain cannot come back. So these are resistant to decolorizer. And here the cell wall is very thin. So decolorizer can easily take out the stain. So these are sensitive to decolorizer. These are gram positive, these are gram negative. So difference in the cell wall, basically peptidoglycan content of the cell wall. So it is the peptidoglycan content of the cell wall which decide whether the bacteria is gram positive or gram negative. If the peptidoglycan content of the cell wall is more, it is gram positive, and if it is less, it is gram negative. This is the principle behind that. You got my point? So you can see the two cell wall here. You can see the yellow color is the peptidoglycan content. So in this bacteria it is more, and in this bacteria it's too thin. It's very thin. It's too thin. You can see the difference. Again here also you can see the same difference. You can see the purple color. Here also it is thin and here it is thick. So gram positive and gram negative, right? So that is the cell wall which decide. So the 4 steps are in front of you. So primary stain, mordant, decolorizer, secondary stain. In the end, some bacteria are violet, so gram positive. In the end, some bacteria are red, so gram negative. This is the summary. So that's all about gram stain in this session. In the next session, I will teach you about acid fast stain and Albert stain, and we will do a comparative analysis between the 3. You got my point? Now, can you answer the same 3 questions which I have asked you at the beginning of the lecture? This is question number 1. I have asked you this question. Question number 1. Can you tell me the correct order of the gram staining? The 4 options are in front of you. Now you tell me the correct answer. You can easily tell me what is the correct answer. You can tell me, is it gentian bolide followed by iodine followed by carbon fusion, or you can see the other options are in front of you. What is the correct answer? A, B, C, D. Write down in the chat box question number 1 ka what is the answer. What is the answer? Question number 2. Gentian bolide coloration of the gram positive is due to what of the cell wall? The violet color is due to peptidoglycan content of the cell wall. Is it due to capsule of the bacteria or cell membrane? So this is the principle of the gram staining. This is question number 2. Can you tell me the correct answer? I guess everyone can tell now if you have watched my lecture attentively. And this is question number 3. Which of the following is a gram positive bacilli? GPB. I am asking about gram positive bacilli. I have divided the bacteria into 4 categories. I am asking about which one of the following is a gram positive bacilli. The 4 options are in front of you. Is it Streptococcus, Salmonella, Mycobacterium tuberculosis, or Corynebacterium diphtheria? Tell me, this is question number 3. Tell me the answer of all 3 questions in the comment box. If you have any doubt still in this session or any session of patho, pharma or micro, you are most welcome to ask your doubts on my contact number. My contact number is 9833032948. You are most welcome to connect with me either on WhatsApp or on Telegram on this contact number. Don't forget to tell me about your college name, about your university and your probable exam date, so I can help you with the study plans which is tailored for you, right? So that is about all the session, and thank you very much for being with me in this session. Now, in the end, I would like to give you a small motivational quote that will keep you motivated all the time so you can study well, right? Keep working hard, keep studying till the day you can say, you become a surgeon and you can say, scalpel please, scalpel please. Now just close your eyes and imagine this scene. You can close your eyes and say like this, scalpel please. You can say this to someone, to your assistant, right? Scalpel please. To your junior doctor who is working under you, scalpel please, right? So the dignity, you know, the feeling behind that, you can feel that feeling, that how does it feel when you reach that day. For that you have to study hard. For that you have to work hard every time, all the day. Now in their entire journey of 5-6 years you are studying during your MBBS, and after that for preparation of your post graduation, you will feel many times you are alone, you are lonely, right? But at that time, always remember this quote, you are working for this day. The aim should be clear in front of you. If you want to become a surgeon, you are working for this day. You are working for this day, right? So thank you very much for being with me and giving your precious time to me. If you like this lecture, don't forget to click on the like button, share with all your friends, colleagues, especially on your batch groups, everyone, and don't forget to subscribe the YouTube channel. And if you want to get notification, please click on the bell icon button. Thank you very much and bye bye. Study hard. I'm ending this session.